So the last thing we need to look at are the various types of sensory receptors, how we can get sensation, proprioception, and how the reflex arc develops within the peripheral nervous system. When we look at sensory receptors, we look at them based off of types and then how we classify them in terms of what they're going to respond to. So we have free nerve endings, encapsulated nerve endings, and then what are referred to as separate cells. So free nerve endings are basically just the dendritic spines of a very long dendritic projection coming away from one of the sensory neurons. Encapsulated nerve endings are where the dendritic spine wraps itself within an extended membranous sheath, whereas the separate cells are cells that if they have projections, we would call them neurons, but since they don't have projections, we don't call them neurons. Within those different types, we have distinct classifications for receptors based off of the stimuluses that we're going to deal with and the locations where we'll find them at. The stimuluses that we respond to is based off of the modality of the stimulus, and this is where we get the misconception of the number of senses that we have. We do not have 5 senses. We have hundreds of senses. These senses include things that are going to be picked up by mechanoreception, by thermoreception, by nociception, by photoreception, by chemoreception, and by osmotic reception. Mechanoreceptors are going to respond to any type of mechanical deformation of the cells. Thermoreceptors are going to respond to any change in heat within the tissues. Nociceptors are going to respond to distinct chemical signals within the interstitium, within the fluids of the body. One of the more prominent nociceptors that are out there in terms of signals is serotonin, but we also have things like histamine that will cause nociception. Nociception is the sense of pain that we feel. Photoreceptors are going to respond to photons of light. Chemoreceptors are going to respond to distinct chemicals. Osmoreceptors are going to respond to changes of osmotic condition or tonicity of the fluids. Along with the distinct type of stimulus that they're going to respond to, we also have where within the body we're going to find them. If they referenced as being exteroceptors, they're going to respond to stimulus outside the body. If they're indicated as being enteroreceptors, they're going to respond to stimulus inside the body. If we call them proprioceptors, they're going to respond to changes of joint position or muscle tension based off of use. Remember, what we're dealing with here is specialized receptors that are going to give a sensory information, an afferent signal that leads eventually to a motor output, an efferent signal within the reflex loop. In this, we basically have receptor being stimulated. It's going to release a neurotransmitter, which is going to cause a change at the synapse, which is going to lead to an action potential. All of this in terms of the receptor is based on what's referred to as the receptor field. And the receptor field is distinct areas within the body where the receptors can be found. The receptor field is going to be found within the receptor organ, and the receptor organ is the distinct anatomical structure where we'll find the receptors. Whenever we're looking at the sensation and reflexive behavior, we always have to pop back to all of the spinal tracts that we spent time talking about. In terms of the sensory tracts, the spinothalamic, the spinocerebellar, and the DCML. And then the motor tracts, the lateral cortical, anterior cortical, reticulospinal, rubrospinal, vestibulospinal tracts. Now, there's something interesting that takes place as it relates to the ability to actually have sensation coming away from the sensory organs leading to the reflexive behavior, in which stimulus leads to reception, reception leads to integration, integration leads to perception, and perception leads to awareness. In this, we have distinct changes that can take place. The distinct changes that take place lead to two distinct phenomena. One known as desensitization. That is where the receptor stops firing, and this is all a peripheral change. And then one known as attenuation. Attenuation is where we stop paying attention to the signal because the rate of action potential is coming away from the receptor and from the stimulus organ is constant, meaning there's no change whatsoever. This is like you not feeling your clothing after you get dressed and not being aware of a certain fragrance that you smell all the time because there's no change in that distinct issue. We'll get more into this attenuation and desensitization as we look at the special senses. So the first thing we need to look at here is how can we differentiate between the sense? That is, how can we differentiate whether we're looking at, say, a dark blue versus a sky blue, or how can we differentiate between the amount of pressure that happens to be pressed onto one of the dermal receptors. And this is where we look at a couple of features. The first feature we look at is what's referred to as coding. Coding is basically the way in which the signal is being passed from the receptor organ to the cerebral cortex, in which we have distinct ways of passing this. It can be based off of what's referred to as modality specificity. Modality specificity is based off of the receptor only responding to a distinct type of signal. Then we have what's referred to as topographic organization. That is, how is the receptor organ itself organized so it can pass the signal along. And then we get what's referred to as peripheral representation. Peripheral representation is the indication of how is the receptor set up as relates to the neurons that are going to pass that signal to the central nervous system. In this, we have what's referred to as the labeled line or the population coding. So labeled line is we have one receptor cell to a actual neuron that's going to pass the signal along. Whereas population coding, we have multiple receptor cells which will all synapse on the neuron that's going to pass the signal along. This population coding phenomenon is why we have more than just 5 senses of taste, and this is why we have an inability to have a topographic organization on the tongue, which we'll look at when we look at how the tongue sets up as a special organ sense. So let's talk a little bit about the stimulus issue. The first thing we'll look at is modality, and then we'll talk a little bit about location in terms of topographic organization before we get into how the receptors actually take place, allowing us to have sensations that will lead to reflexive behavior. So the first thing we're going to look at is modality. Modality is the classification of the stimulus. That is, what is the receptor actually responding to? In this, we have what's referred to as a submodality. This is the quality of the stimulus energy. This is how we can distinguish between a sharp tone versus a flat tone, a major versus a minor chord. This is how we can distinguish between white and white. And yes, there are different shades of white. This is where we can distinguish between something that is a good fragrance versus something that is an awful fragrance. When it comes to the location issue, what we're really talking about is we're talking about where in the body are we finding the topographic map, where are we finding the receptor organ, and then how does this actual receptor organ traverse into the cerebral cortex based off of its topographic organization and its peripheral representation. So we've listed off a couple of distinct, what we usually refer to as senses. Those are the senses that we normally talk about when we talk about senses, even though we have many more senses than these senses that are listed. So try to think about, when we look at the special senses, where we're going to take our topographic map and send it into the central nervous system, and how is it going to keep its orientation so that what we are able to sense peripherally is what we're able to perceive centrally. So the first thing we look at in terms of location is, where is that stimulus actually at? So if you notice, there's different regions that we'll see within the skin, and each area of the skin, as we saw with the homunculus within the somatosensory cortex, has a differential response in terms of how receptive is that area to the sense. Now if you notice, coming from each area, we're going to have a different neuron that's going to traverse. This is one form of topographic organization. That is, where within the receptor organ is the specific neuron traversing. The other way of looking at this is through the topographic organization that we had previously looked at when it relates to the somatosensory cortex. That is, how does the anterior, posterior, superior, inferior, medial, lateral representation of the receptive field get sent into the primary cortex, and then how does that get integrated within the secondary and tertiary cortices as we integrate in order to have full understanding of that sense within the environment. We'll get more into this when we talk about three-dimensional representation of sight and sound within special senses. The other thing that comes into play here as it relates to location is the idea of the domain. The domain is where within the receptive field am I most sensitive or most selective to the sense. That is, how can I determine where exactly is the stimulus causing the reception to take place? Part of this deals with the idea of accommodation. That is, how quickly can I manipulate the receptor organ to change how sensitive that receptor organ happens to be. All receptor organs have a degree of accommodation, even though we only talk about accommodation within the textbooks as it relates to vision. But all senses have accommodation issues. So the first thing we look at is, where within the receptor organ am I going to have the least amount of stimulus versus where am I going to have the most amount of stimulus necessary in order to have the response that I need. And so this is going to set up the domain area, the area where I need the least amount of energy, versus the most selective region, the region just peripheral to the modality. So we have our area of most sensitivity, that is where it requires the least amount of energy to fire. And then we have our area of most selectivity, that is where I need the most amount of energy to fire. Where I am very selective, I can discriminate very easily. Where I have the most sensitivity it's very hard for me to discriminate. Some areas we have very good quote-unquote tactile sense, such as the tips of our digits, where we can be both very selective as well as very sensitive. Whereas areas like on the nape, on the posterior aspect of the cervical region, and through our posterior thorax, we don't have as much selectivity to what's going on in terms of where exactly something happens to be, simply because the domain range is so narrow in that area that we cannot have high sensitivity within the receptive field. The last thing we look at is how is the receptor going to fire? And in this case here, we have two distinct ways of doing it. One is referred to as the center surround issue, and one is referred to as the lateral inhibition issue. And what we're looking at is we're looking at how does the receptor cell itself go ahead and fire when it becomes activated. So the first thing to look at is what's referred to as the center surround issue. On the center surround issue, we have one of two options. We're either on center or we're off center. So notice as the bar stimulus is passing along. If I'm on center, my rate of activation from the neuron is very high when the stimulus is on the center. Whereas if I'm off center, the rate of action potentials increases as the stimulus exits the center, which means that when the stimulus is on center, I don't get very many signals on the off center, whereas in the on center, I don't get very many signals unless it's specifically on the center. On the other side, we have lateral inhibition. What lateral inhibition does is allows me to be excessively selective. What ends up happening is that the neurons that are being activated in that region send collateral branches just lateral to that area to inhibit any other signals coming from the area, so that the only signal heading to the cerebral cortex is that specific region. We see on-center, off-center within the retina, as well as within some sensory organs on the tactile areas. We see lateral inhibition most prominent within the cochlea. Two key things that we have to remember when we're looking at sensation and how the sensory receptors are going to fire is the idea of accommodation and adaptation. Accommodation is how well can I fine-tune the receptor, that is, can I broaden or narrow the domain to change the amount of energy necessary to have the receptor fire. The other idea here is adaptation. Adaptation is how quickly will the receptor turn on versus turn off. In this, we have what's referred to as a fast adapter, very quick to turn on, very quick to turn off. It doesn't need a lot of energy change, versus a slow adapter. A slow adapter, it takes a lot of energy for it to turn on, and it takes forever for it to turn off. This adaptation phenomenon is what's going to trigger the receptor, and this triggering is what's going to lead to the sensation that we feel. There are going to be some receptors that are very fast adapters. There are going to be some receptors that are very slow adapters. The rate of adaptation is one of the key factors that comes into play as to whether or not we're going to have desensitization, the loss of that receptor, due to overexposure to the stimulus.